Hi, my name is Cole Wyant, and I want to tell you my story. I recently got on an airplane and left a city with thousands of dentists to fly across the country, probably flying over certainly hundreds of thousands of dentists to land at the world-class facility of the Utah Smile Clinic. And I'm here to tell you why, in my opinion, you should do the very same thing. Um, I'm 62 years old, and I had a very degenerative dental challenge, right? I had a dentist say to me, a world-renowned dentist say to me recently, Cole, you have the jaw of an 85-year-old woman, right? And so I had a serious problem. I'm an executive that owns several businesses, and so public presentation and lots of work on camera, image is extraordinarily important. And with this degenerative problem, I was putting apparatus in my mouth to kind of hold it together. A lot of back teeth were gone. Eating was difficult, right? And obviously I needed to come up with a permanent solution to what had been a vexing problem that had been nagging me for many years, right? So I go speak to several dentists. Incidentally, I have two cousins that have both spent greater than 2 decades each in the dental world as office managers of various dentists. I got their opinions, and their dentists took a look, and I spoke to a dentist who's an executive with a state dental association, and just extraordinarily highly regarded, and a couple of YouTube rock stars in the dental space that probably, if I mention their names, you would might recognize if you're out there doing research. I was turning over every rock, every stone, looking for alternatives. Generally, what was coming up was that someone would cut into my gums, right, remove an important part of my gum, put a plastic pink gum, affix it into my mouth with teeth, right, an all on 4, all on 6, all on X kind of situation. And I had pretty much resigned myself that, although it didn't sound appealing, it sounded more appealing than leaving my teeth on the nightstand at night, right? So I'd pretty well resigned myself to do that. And I happened upon, it was just godsend, right? A video from Dr. Andy Roberts in the Utah Smile Clinic. And it opened my eyes to what was clearly and immediately a better alternative. These are my gums, right? And affixed to my gums are a series of bridges, right, with a half a dozen post implants on the upper and the lower, right? Now, I can tell you I've now had my permanents for a matter of a couple of weeks, and they feel, click, and act just like the teeth of my youth, although they're whiter, which is important to me from a professional presentation image standpoint. And in terms of cost, right? For some, that's particularly important. Honestly, in my case, it was a little bit less important, right? But cost, right? I had a dentist who is, a legitimate rock star in the YouTube sphere, we'll call it, that offered me a lesser in product, but it would have required 6 flights and trips to his city, right? Over a period of 18 months, right? The cost was precisely and exactly the same as what I paid at the Utah Smile Clinic, which I consider to be an extraordinary value, plus the cost of a Mercedes, right? So I could either have my treatment at the Utah Smile Clinic, or I could and have money left over for a car if that's what I chose, right? Or I could pay his fee, right? Which would be the cost of the Utah Smile Clinic and the cost of a car, right? 6 trips, which put several days each time, so it's several meaningful opportunity costs with me being away from the post in terms of my businesses. It's cumbersome, of course, too. Hotel rooms and discomfort. And a year and a half seemed to me, I'm 62, right? Seemed to me like a decade and a half, right? I think we all tend to be more instant gratification animals. In the case of the Utah Smile Clinic, I show up, they work their magic, and I come back in 3 months, and they put the permanence on there, and yeah, I'm all done, right? At a fraction of the other costs that I was looking at. Let me say to you that when I presented myself at the clinic, you see it behind me, first class facility, but everything about the process was worked just like a Swiss watch, right? They have a facility, a hotel directly next door that they work hand in glove with. The folks in the hotel essentially are the extension of the Smile Clinic's staff. They're intimately aware of the fact that a large percentage of their patients are flying in from all over the world, right, to have access to Dr. Randy Roberts and his team, right? So, and when I finished my initial surgery, removal of teeth and bone grafting and stuff, right? They wheeled me right over in the parking lot that's in front of you to the hotel, and it was really seamless, right? In terms of the process. When you go into the facility, though, everyone is just optimistic and upbeat. You can feel in the air the joy and the love and the optimism that emanates from them as it relates to their faith. You could just, it's not talked about, but it's just, you feel it. Their face lights up, right? You can tell everybody wants to be there. They're attractive people with attractive smiles and attitudes, well presented in terms of grooming. Everybody I encountered knew their job intimately well, and I touched, I don't know, 12 or 15 people, and with the 2 trips that I made there, from administrative folks and taking care of administrative things, payment and the like, to x-rays, to just the whole gambit. All technicians took their role seriously. They seemed to feel like they were on a mission, right? A mission of service, right? You're getting worked on, and you're hearing them hum or sing, or the pleasantry, the vibe was just extraordinary. The facility inside is amazing, with really high ceilings, which give you just this real voluminous kind of feel. You don't feel like you're in a dental office, right? You're crammed into a space. There's no doors on those offices, right? So feel like you're sequestered away, right? It's kind of an open, comfortable concept. There's enough barriers for privacy, but you don't feel locked away, right? And then the thing that probably astounded me the most, that I'm not going to be adequate in conveying to you, is their use of technology. The only way I can explain it is that it's like NASA for a dental practice, right? They have an offsite lab that they own, that part of the family of Dr. Roberts is involved in the running of, and that they're being brought into the room through iPads and communicating both with me and the technicians, and with the doctor, in my case, Dr. Roberts, right? Even the most modest of modifications were taken with the most paramount of importance, right? But that the lab was in the room, more than a half a dozen times over the course of my treatment, for refinements or making sure that everything was perfect, right? So the lab was sitting right next to me, essentially, right? Amazing, right? The process that they went through was like a Swiss watch, right? They're just perfect technicians. My wife and I were in awe. We own businesses. We appreciate a well-run business. It was extraordinarily clear to us, from being greeted by a receptionist that instantly knew our name every time. 3 months later, we walk in, they instantly know our name, right? To everybody that we touched inside of the facility. To give you a feel of the value that we felt for the organization, the few days after we returned, we had lunch catered for the entire, just our own way, a small token of our appreciation for their entire staff for for a day, 2, 3, 4 days after we were returned from the clinic, right? Just as a thank you, right? So we felt compelled to go above and beyond the call of duty in terms of what we were asked as a patient, because we wanted to reciprocate what we thought was service and treatment and kindness that was well above and beyond the call of duty for a dental practice. So I'm going to wrap this up, but through the clinic, if somebody wanted to talk with me, I would be more than happy to receive email communication or a telephone call if you're considering the Utah Smile Clinic. But I can tell you without any reservation or hesitation that I've had more dentists with hands in my mouth than I could count over the course of my lifetime. And I can tell you it was by far and going away without question the single most positive experience I've had with a dentist in my life. And it was a very comprehensive, very complicated plan. Let me also add that dentists that were looking at my mouth, when I told them this is what I'm being presented with the Utah Smile Clinic, 6 dentists said to me, it's impossible. It can't be done based on the condition, the degenerative condition of your jaw. This is a charlatan. That word came out of a dentist's mouth. This is impossible. You're being fed a bunch of stories for the purpose of making a sale. I mean, these are the things that I was told. Honestly, I'm a businessman. I called Dr. Roberts on the carpet for that stuff in a Zoom meeting, which he was happy to take with me, and his confidence and comfort and his expert way of fielding my questions had me entirely and totally comfortable to set aside the advice of 6 other dentists. And I said to my wife, send the man the money, right? And let's go, right? And again, I'm delighted that I did it. So just reach out to me if you need any more amplification or clarity. But if you don't, then I would recommend you hop that same plane. You leave the dentist, the ordinary standard dentists in your community, fly over. In my case, it was I had a long distance to fly, hundreds of thousands of dentists land in beautiful Salt Lake City with a clinic that's surrounded by snow-capped mountains and 12 months of the year, and enjoy the services and value that you'll get at Utah Smile Clinic. Thanks for your time and for your attention.